Hello, good afternoon, everyone. I am sorry, I am starting a few minutes late. I'm going to give you guys a chance to log on. Thanks for joining me today. As you come online, please wave to me or type your name into the chat so that I know you're here and that I can welcome you personally. Thank you. Hey, Lee. Hey, Number. Thank you so much for being here. I appreciate you being here. We're going to talk about what to do if the condom breaks. And so that information hopefully will be good for everyone. I know that's a situation that happens many times. It may have happened to us personally. It's certainly something that I hear a lot from my different patients. So I'm looking forward to us chatting about this today. So thank you for being here. Okay. If you guys know of anyone who might be interested in this information, please, by all means, forward this or share it, and then we'll go ahead and get started. Again, I apologize for being a few minutes late today. I was multitasking and got caught up, a little delayed. So let me see. Hey, Delphine, thank you so much for being here. I appreciate you. So far, we have Lee and Delphine. I see a couple of other people are watching. And again, if you're watching, feel free to wave or type hello in the chat. And I'm going to go ahead and get started. This is a topic I always get a lot of questions about this, what to do if something happens when you're, in the course of sexual activity or something, and the condom breaks or something happens. And so I figured today we would talk about emergency contraception, emergency birth control. Can you guys hear me okay? Lee says, I know this one, jump off a bridge, right? No, no, we don't have to get to that point yet. There are some things we can do before the bridge. So we'll talk about some of those options today. So let me go ahead and officially introduce myself. And again, as people uh, come on to the live, please wave at me or type hello into the chat box. Hey, Pam, thank you so much for being here. Hey, Ray, thank you for being here. Okay, good. Ray says she can hear here as well. So let me introduce myself. I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. I help busy women, whether they're busy inside the home or outside the home, access the GYN information and birth control care that they need so that they can have the most control and freedom of their lives. Please feel free to follow me on Instagram, Facebook, and Twitter at Dr. Madeline MD. That's DrMadeline MD. Okay, so thank you all for being here so far. Hey, Kate, great. You guys can hear me. Hey, and my oldest is joining today. Hi, son. Thank you so much for being here. So, again, this is an important topic because it comes up so frequently. You know, people have different things going on. Maybe a condom breaks, or maybe they have not taken a pill or missed a couple of days. And so the question comes up, what happens if I'm in a situation and I don't want to have an unplanned pregnancy, but I need some reassurance that if something happened, I'm not going to get pregnant from that situation. So let's talk about that. So one of the things we call this group of techniques or medicines that we do when this type of situation happens is called emergency contraception. An emergency means, just like it sounds, it means something has gone wrong, that was something was unplanned, and to try to decrease the chance of there being a pregnancy, we have some different things that we can do to try to make sure the woman is able to prevent a pregnancy if she doesn't want it. So the three things that we're going to cover today in terms of emergency contraception is what is emergency contraception? And that definition is basically there are different options that we can use in the realm of OBGYN that will help prevent a pregnancy from occurring if there's been an episode of sex where there was not adequate protection. The second thing we're going to talk about are the different types of emergency contraception. There are types of emergency contraception that include pills and also include an IUD, a copper IUD. So we're going to talk about some of those types. And the third thing I want you guys to know about emergency contraception is that ideally, when a situation happens, and let me caveat this, I'm only talking about consensual sex. Now, there's a whole different time when we might use emergency contraception when there was, like a sexual violation or someone was assaulted. In this situation, I'm pretty much just talking about consensual sex situations where something happens and someone wants to prevent an unplanned pregnancy. So, the third thing that I want to talk about, because of the context of consensual sex, is the fact that when someone has to use emergency contraception, that is also an ideal time to think about or plan for or consider getting a permanent contraception or something that will last beyond that emergency contraception situation, so that returning to use emergency contraception doesn't isn't required. Okay, so that's one of the things I love to get to with my ladies. If we have a situation where we do use emergency contraception, just making sure that they know that there are options if they would prefer not to get pregnant for an extended period of time, then what some of those options are. Okay, so let's go ahead and get started. And if you guys have questions as I'm talking, please feel free to put them in the chat, and I will answer your questions as to the best of my ability. So, the first thing I wanted to talk about in terms of emergency contraception is what it is and what it is not. And so, sometimes when people are talking about this topic, there's some concern from people who aren't familiar with the different ways that emergency contraception works. There's some concern that emergency contraception causes abortions or causes pregnancies that have already started to stop. And that is absolutely not true. Emergency contraception works by being used within, usually the window is 72 hours to as far out as 5 days after an act of sexual intercourse occurs where there's some concern about something having gone wrong. And so the reason it works in that small window is because it works by preventing a pregnancy from happening. If you have someone who is already pregnant, if they're at the point where they've already missed a period, that is beyond the window for which emergency contraception is going to work. And so, what I usually tell my ladies is that it's absolutely imperative that as soon as something happens, whether it's going to the drugstore, and we'll talk about how to access these different types of emergency contraception. So, whether it's going to the drugstore, whether it's calling your OBGYN, the most important thing to do, if the condom broke or if you missed several periods and you think you were ovulating at the time that the sexual act occurred, the most important thing to do is to jump on it as quickly as possible. Okay, jump on it meaning figure out your next step as quickly as possible, whether that's going to the drugstore, whether it's calling your provider and trying to get in to be seen, so that you can still have some different options that are in that 72-hour or 3 day to 5 day window. Okay, so that's the very first thing I want you guys to know, that emergency contraception works by preventing the pregnancy from happening. It does not cause abortions, and I think that's really important, so that that myth of not wanting to use emergency contraception can maybe be resolved somewhat, because that's absolutely not how it works. So, what are the different types of emergency contraception? So, most times when women are using emergency contraception, they're using the different forms of pills. And there are a couple of different ones that I want you guys to be aware of. The other type of emergency contraception is actually an IUD, or an intrauterine device. And we'll talk about that some more. In the past, we've talked about it as one of our LARCs, or long acting reversible contraception. And so, certainly, it's an effective form of emergency contraception, and we'll talk about that some. But what are the more common types? So, if you guys are familiar with something called Plan B, that's actually a very popular form of emergency contraception. It is the one that's Plan B and other forms of Plan B that have the basically progesterone only emergency contraceptive pills. They are sold over the counter for women who are 18 and above, based on the FDA requirements, and they can be purchased in most drugstores. If a young lady feels that something has gone wrong and she wants to access something as quickly as possible, she can go to a neighborhood drugstore or grocery store, wherever it might be sold, and ask about a Plan B. Now, she would take the pill, and as the instructions provide, and usually there might be some nausea with it. She might feel a little bit crampy for uh, for the time that she takes the medicine. Oh, I'm sorry. Okay, you should definitely copyright that. Oh, thank you, thank you. That term is actually widely used, LARCs or long-acting reversible contraception. But thank you, son. And absolutely, it's something that I love talking with ladies about, LARCs. But for Plan B, it's sold in a lot of drugstores, and I want young ladies to be aware of this because even though something is sold in the drugstore over the counter, it doesn't mean that it's completely comfortable to go in and ask for it, or that a pharmacist in a drugstore will be without judgment when they're giving you something that you ask for that's sold over the counter. And so I want to talk about that a little because it's important if you are in that window, if you have any trepidation about going to the drugstore, try to take a friend, call for backup or someone who can support you if you are nervous about going to the drugstore to get the pill. Um, or one of the things that sometimes my young ladies will tell me is that they'll have a friend who's slightly older go in. Because sometimes what happens is pharmacists, even though it's completely legal and over the counter, they will. Sometimes women, young, especially younger ladies, my teenagers will describe that they're made to feel badly about wanting to purchase that pill, Plan B. And so, what that can be something that can hamper, right, a young lady if she's trying to access something and the person who has control to that pill is making her feel badly. Certainly, that's something that can be a hindrance, and it's something that I hear a lot of my teenagers tell me. Often, teenagers, including age 18 and 19. And so, I just want to encourage young ladies if that's something that happens to you. Try to go with a friend, find some reinforcements. But also, this is the other thing I want you guys to know. If you find a pharmacist that is friendly, teen friendly, that doesn't give you a hard time, that doesn't create barriers to you trying to get what you need, tell your teenage friends about that pharmacy. Make sure that as much as possible, young people who are trying to access what they need have information about who is user friendly for them. Okay, I find that that is a huge barrier when it comes to my teenagers, and it breaks my heart. It shouldn't be that way. If you need something and it's over the counter, you should absolutely be able to get it. All right. Another pill that's used for emergency contraception is one that's called Ella, and that one is actually by prescription. Now, it does have a longer window. Plan B works best within 72 hours. But even more importantly, the sooner you take it, so if it's 5 hours, 6 hours, 12 hours after the act of sexual intercourse with a condom broke or you forgot your pills or something like that, the sooner you take it, the better. But the maximum window is within 72 hours. So that's with Plan B. Now, if it's Ella, which is the one that's by prescription, that is the one that can work within 5 days. So you have up to 5 days to access a provider, or there are some online entities actually that if a young lady screens correctly based on her medical history questions, sometimes they will send something online that you can take to the pharmacy and be able to access it right away in case you can't get physically into someone's office. That's important to keep in mind in the age of COVID, if you're having trouble getting into someone's office. And so that's important to know. We have a question here. Is there a limit to the number of times a young lady can request Plan B from a pharmacy? No, there is no law on the books. I'll put it this way. There's no law on the books that limits how many times a young lady can request Plan B from a pharmacy. But remember, keep in mind, I mentioned to you the times that pharmacists can sometimes be judgmental or be barriers. So definitely keep that in mind. There are many stories from young ladies who have challenges, especially depending on what part of the country they live in, because some pharmacists are not as user friendly for women being able to access those things. And so there is no legal definition or finite number of times that someone can access Plan B if they need it. Now, as an OBGYN, and this was going to be the third thing that I talk about today, accessing emergency contraception is an ideal time to have a conversation and figure out what type of longer term birth control you might be interested in. Okay, that's so crucial. I've had a lot of times when a young lady, if I'm giving her a prescription for Plan B or for Ella, because Ella's by prescription and Plan B is over the counter, we'll have that conversation. Hey, I know this slip up was a one time thing. Are you interested in something that would be preventive so that you won't necessarily need the Plan B again in the future? Sometimes it's a no, but a lot of times it's yes. I'm glad, this happened. This was a wake up call for me. I've been thinking about getting something more longer term. And so, yes, doc, let's talk about what some of the different options are. It's a perfect opportunity to have that conversation. Is there a reason someone should use Ella versus Plan B? Um, Great question. Plan B is just the one that's easier to access. So I would say a main reason to go for Ella versus Plan B, let's say someone has gone to the pharmacy, they felt uncomfortable, it's now at the fourth day, and they don't yet have a mechanism that will help them, then that is someone who would probably benefit from Ella because they still have a longer window during which the Ella can work. So again, Plan B, it's up to 72 hours or 3 days. Ella, it's up to 5 days. And so that's a great question because Ella does provide more time for a young lady who might have had some barrier or hesitancy. Sometimes people are just really nervous and scared. And so Ella does provide more time for that. But and also Ella is kind of non-hormonal, but both of them have a really good safety profile. And so from a safety profile, they're both pretty good. It would be important that the person talk with their provider if they have any unique medical situations going on. But in terms of what would be the main reason would be number of days from the event that happened. Okay, so we've talked about the two types of birth control pills that are marketed specifically for emergency contraception. Plan B and all the generic forms of Plan B, like My Way and Take Action and all that, and the fact that those are over the counter. Ella, which is non hormonal, it blocks the effects of key hormones that are needed for conception to happen. That's by prescription, and that works up to 5 days. Before we had these pills that are marketed specifically emergency contraception, we would use regular packets of birth control pills that are available in hospitals. For example, in situations of sexual assault, for decades before these other pills were on the market, we would take like a regular pack of pills and give them to a woman, 5 pills at once, 4 pills at once, over 12 or 24 hours to work the same way as emergency contraception as these other pills that are on the market. We don't do that anymore because these other pills that are on the market are more effective, but it's something that can be used if needed. Okay? The third form of emergency contraception that I want you guys to know about, and it works extremely well as emergency contraception, is actually the copper IUD. So if you have a situation and you're within that 5 day window and you can get in to see your provider because the IUD does require that you go to your GYN or a nurse practitioner or a midwife, anyone who's skilled with inserting an IUD. It does require that you go to the office to have the IUD inserted. And so the copper IUD is not only the most effective form of emergency contraception because if it's in there within 5 days, it will prevent a pregnancy from happening. But if that woman or young lady or the person with a uterus is interested in long term reversible contraception, then she can leave that copper IUD in place. And if you guys recall from some of our other talks, that copper IUD can be in place for long term contraception for 10 years as approved by FDA, but up to 12 years, the safety data has shown that a copper IUD can be in place for up to 12 years. And so more and more as young women are learning about the effectiveness of a copper IUD as emergency contraception, many of them, if it's the one that they use in an emergency contraception situation, they love having the option of keeping it there for up to 10 years if that's what they choose to do for long acting reversible contraception. Okay? So so those are the three types again that I want you guys to be mindful of. Plan B, up to 3 days over the counter in the drugstore. Ella, which is by prescription and can work up to 5 days, and then a copper IUD, which can be inserted up to 5 days after a situation, as my sometimes my young ladies will call it, after a situation has occurred. And the third thing I want you guys to know, and we started to talk about this a little bit as we talk about the copper IUD, really, really consider any time that you have an emergency contraception need or situation, whether it's the condom breaking or anything like that, always look at that as an opportunity to think more broadly about your birth control options and your birth control needs. Because a lot of times when I'm talking with young ladies, there may have been a variety of reasons that have prevented them from coming in to get birth control or to start something or to consider their options. And a lot of times that situation where a condom breaks or something like that, it's really a wake up call to have a bigger conversation in case a longer term contraception is what they're interested in. And for many times, for my ladies, that's absolutely something that they're interested in. Now, emergency contraception, when it's used as directed, when it's taken within the window that is recommended, whether it's 3 days or 5 days, it's over 99% effective in preventing a pregnancy. Okay, that's very important. And so it's important because I don't want any young lady out there to be so fearful that she misses that window. Because if you come in that window, you can definitely have an effectiveness rate that's high, over 99%. Okay, so please, please, please keep that in mind. Share it with other young ladies in your circles and mature. I say young just because I just kind of group everyone in that category, but young means, from as young as whatever age someone might be when they're having sex to mature, because the average age for menopause in this country is 51. And so emergency contraception needs are required by women across the lifespan. So when I say young, I mean all women who are having a cycle, who can potentially get pregnant, who might be having a good time at some point and something happened and they have a need for emergency contraception. All of those ladies are young, and so I'm talking about all of us. Okay, so let me know if you have any questions in the chat. Did I answer your questions okay, Pamela and Malum? In terms of there not being really a limit, a legal limit to how often a young lady can request Plan B, and Malum, in terms of is there a reason someone should use Ella versus Plan B? And another reason to consider, Malum, might be if someone has taken one of them in the past and they had like a bad reaction to it, an allergic reaction, or they got really sick or something, then the recommendation would probably be that they try the opposite or the other medication, if depending on what their window is. Okay, so oh, thank you, Lorraine. Thank you, thank you. Lorraine said, "This is awesome info, Mad. Thank you. I'm sharing. Awesome. I'm glad it was helpful, Ray." And Kelly says, "Hey, Kelly, thank you for joining today. If anything happens over here, I am suing, but good to know for my daughters." I hear you, Kelly. That means you must have something almost permanent in place. And I understand. I have patients tell me that all the time, that they don't expect something to happen in certain situations because they've kind of taken care of um, what they have in place. Okay, so thank you guys. So I just want to recap before we finish for today. So today we covered emergency contraception. Oh, hey, cuz Cheryl, thank you for joining. Thank you for the info. I will surely pass it on. So today we talked about emergency contraception. This, guys, y'all know this include we know of those of us who are. Yes, Pam says colleges should have this information shared at college orientation for males and females. Absolutely, because I think that's one reason why I wanted to cover this topic, because I find that when I have a young lady that I'm seeing in the clinic, in the office, or in the emergency room, there are a lot of people who don't really know or understand what emergency contraception is or how it works. And so, absolutely, we need to share this information, get it out there widely. There are some times when I have an opportunity to speak to different colleges. Hey, Sharon Joyce, thank you. She says, nice job. Thank you for joining today. I appreciate you. And so, yes, this information is important, especially for, like you said, our young uh, orientation for our young men and women who are on college campuses because, again, a lot of times when there's a slip up, people are almost paralyzed by fear. And one of the important things I think to know about this information is that fear is natural. That's okay. But I want also people to feel empowered that there are steps they can take before things go on for too long. And so, absolutely, if someone has, a condom break, forgot their pills, they missed their depot shot, they weren't able to pick up the medicine, or whatever the reason might be. And that's the other thing to know that is that there's no judgment attached to going in and seeking care for an emergency contraception situation. But absolutely, this information is vital for, like I said, women young to mature. Okay. So yes, again, to recap, the three things to know is that emergency contraception works by preventing pregnancy. It does not cause abortion if someone is already pregnant. Emergency contraception will not cause an abortion. Uh, the second thing we talked about are the types of emergency contraception. There are dedicated pills that are FDA approved for emergency contraception, and those include Plan B, which is over the counter, and Ella, which is by prescription. Plan B works within 3 days or 72 hours of the event, and Ella works within 5 days of the event. Okay, and you guys understand what I mean when I say of the event. So if the condom breaks on Saturday, you have until sometime Wednesday to get to the drugstore if you want to try for Plan B, or you have until Friday to get to your OBGYN or nurse practitioner or an online resource to get either Ella or an IUD inserted, a copper IUD. But again, the sooner you get in and get access closer to the event, the more likely the emergency contraception is to be effective. Okay? And the third thing is that if you ever do have a need for emergency contraception, think of it as an opportunity to have a conversation and to go ahead and transition to whatever type of short acting or long acting contraception you might be interested in, whether it's the pill, the shot, keeping the IUD in. If you get the copper IUD placed for emergency contraception, it can just stay there. Okay, and it can be in place for up to 10 years. It doesn't have to stay the whole 10. If you want it in just for 2 to 3 years, that's fine. It's just a conversation that you have to have with your provider. All right, so I want to thank you guys for joining today. Oh, thanks, Pam. Pam said agreed. Information is power. I want to thank you guys for joining today. As always, it is my joy and pleasure to chat with you guys. I'm glad that you are finding this information helpful. And we will come back and talk again next Sunday. And I'll let you guys know what we're going to talk about. If you have different topics that you would like discussed, please feel free to put it in the chat or DM me or post it on my wall during the week. I'm also, after we finish talking today, I was quoted recently in an online resource about Plan B, and it'll provide some more information and details about Plan B. So I'll post that on my page in case any of you guys are interested in reading that. So, again, I want to thank you guys for joining this Sunday chat with Dr. Madeline. I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. I work with busy women, whether they're busy inside of the home or outside of the home, access accurate GYN information and birth control needs that they might have so that they can have the most control and freedom over their lives as possible. And ultimately, what does that lead to, y'all? Y'all have heard me say it before, more worry-free and joyful sex, okay? All women deserve that. And so I appreciate y'all being here. Please feel free to follow me on other platforms, Twitter, Instagram, and Facebook at Dr. Madeline MD. That's DrMadeline MD. Thank you guys so much for being here. I love y'all. I appreciate y'all. And I will see you next Sunday. Dr. Madeline is out.